Okay, my name is Dr. Charles Roth, and I'm a clinical psychologist here in California, and my specialization is neuropsychological assessment. What it means is that uh, there's a whole process that the psychologist follows where they gather information from parents and teachers and the students, and then they also give various kinds of tests with the idea of figuring out how does a student learn best and what might make them be more successful or help them be more successful. Well, here's what happens. Sometimes a student is having some kind of unpredicted learning problem. So it could be that, like in early elementary school, the kid is really having difficulty learning how to read, for instance, and it's like, it just surprises everyone. Or they're having trouble following directions in the classroom, or they kind of seem to just get lost a lot with follow through, or it just takes them really long to complete work. So I mean that's with younger kids. But what parents often want to figure out, and schools will suggest this too, is, well, what's going on here? Because the kid seems really capable, but this just doesn't add up, that this is taking so long. So that's the reason usually that people come in for testing. Okay, well, it depends on their age level, because there's kinds of different questions like what would help a nursery school kid, for instance, do better with transitions. That's one set of things that you might be doing. But also, I'll have like kids who are going off to college or university, and so they may benefit from things like having a note taker to help them in classrooms, or being able to test someplace that's relatively quiet so they're not going to get distracted. Or lots of colleges and universities now have text in audible format or digital format, so sometimes it just helps people to hear it rather than, and read it at the same time rather than just slog through the readings. Okay, well, here's what it involves. It involves, first of all, taking a really careful history, and because I want to see are there similar problems in the family, because a lot of it's genetic or can be genetic, or were there difficulties at birth that's related to later learning problems. And then parents and the teachers and the kids fill out rating scales. And rating scales basically, they're on different topics. And what it allows me to do is to like look at the responses and see how they compare with, like, let's say it's a 12-year-old boy. So how does his teacher's responses compare with other teachers in the United States about expected behavior, for instance, for a 12-year-old. So that's the rating scales. And then there's the tests themselves, which in the areas are memory, reasoning, processing information, executive functioning, handwriting, and attention. So that's basically the area. And of course their academic work, right? Like I have kids do things like take reading tests and see how they do in reading. Okay, so the outcome of all this work would be that I really carefully look at all the data that I've gathered, and then I can see where it kind of groups together, and it helps me understand where the students' strengths are and how they can use those to help overcome areas where they have weakness. So that's one of the outcomes from it. So it could be like, sometimes kids are, they've just developed these really cool memory strategies. And so that can be useful to know so that they keep using them or even increase them. Or I can also look at what they're not doing and then make suggestions about what they could be doing that would help them be more effective. Now, why do I do it? Well, I do it because it's really fun. It's really enjoyable. I love working with students, and I'm really intrigued by learning. I've spent most of my life either in school as a student or teaching. I was at San Francisco State University for a number of years, or working in academic programs, and I just find learning really interesting. That's why I do this. And also, it's so satisfying to be able to make suggestions and recommendations that really help students feel better about themselves and be more successful, you know, because that's their job. It's like they report to their job every day, and when you're having trouble with it, it gets kids really demoralized. So when they can see success, that's wonderful for them, and it also is I just get a lot of pleasure out of that.